International travelers encounter a variety of risks when they're outside of their home countries. These risks may include food, water, and insect-borne diseases, infectious diseases, altitude sickness, and respiratory problems. In addition, poor road infrastructure and chaotic traffic conditions in some countries put travelers at a greater risk for traumatic injury. MEDEX has been dealing with these kinds of medical issues and many others for over 30 years. In that time, we've built an extensive network of over 59,000 providers in 235 countries around the world. We seek out the best local facilities, ones that have experience dealing with international travelers and whose doctors have Western training. MEDEX is constantly updating this network to include newly built facilities. In addition, we regularly add new destinations based on leisure and business travel patterns around the world. MEDEX clients traveling overseas have access to pre-travel services that provide them with information and preparation for their trips. Among these are destination reports, which include information on providers, as well as security advice and emergency contact information. In addition, we provide lists of recommended vaccinations. Clients going to more remote destinations often request contingency reports, which detail the way that MEDEX would respond to a serious medical condition and the likely evacuation destinations from a given location. MEDEX also periodically conducts site survey trips to various countries around the world, especially in advance of major global events. One recent example of this is the trip I made to 6 Olympic venue cities in China in advance of the Games, and I'll talk a little bit more about that later. Let's see. Now I'm just going to show you some of our current level 4 cases, which are generally evac repatriation cases around the world. And you'll see the whole gamut of locations that we have. Now, also you'll see the age range, which goes from very young to quite old. You see we have an 82-year-old woman with a fractured right femur in the United States. We have a 39-year-old with meningitis in South Africa. We have septic shock in India, 60-year-old male. Colon cancer in the United States. Hemicolectomy in the United States. Cardiac arrest in Canada. A fractured left leg in Croatia. Cystic cancer lesion in Canada. So it's the whole range of medical problems that we get all over the world, sometimes in locations with quite good levels of care, sometimes in locations with terrible levels of care, frankly, depending on where they are. Now I'm going to talk to you a little bit about some of our preferred hospitals. These are actually the centers of excellence that we work with. I think if you click on and go to the next, okay. We have 100 centers of excellence in 38 countries around the world. And these are basically the top facilities that we use. These are ones that we evac patients to from other locations. They tend to be the best and the most advanced in the region. They tend to be in larger cities, for example, airline hubs, major commercial centers, and they have the best diagnostic and treatment capabilities. We look especially at their nursing practices because oftentimes in certain less developed countries, you'll find that the nurses really exist mostly just as helpers for the doctors, which is kind of the old model we had in this country at one time, perhaps 50 or 60 years ago. Whereas in North America and in Northern Europe, for the most part, nurses tend to be very well trained. In certain countries, they really don't have that much training at all. And so that's one of the things we look at very carefully. We look at what kind of accreditation they have. For example, whether they have Joint Commission International accreditation, which is one of the major international accreditations that are now available. And most importantly, we look at their experience in working with international travelers. Because, you know, it can be an excellent facility, but if no one there speaks English, then it's not going to be of very much use to us, frankly. We really want the best facilities that have the most experience in dealing with international travelers and expatriates. Now, this is an example of a hospital that we visited in Bhutan, and I think you can see why we weren't very happy with it. This is a government hospital. You look at it, it's not very clean. The equipment is old and frankly looks kind of scary. I don't think any Western traveler or expatriate would feel very comfortable being treated in an environment like this. Look at the exterior of the hospital, and you see it looks quite decrepit and, not very inviting at all. If you showed up to a place like this, would you want to go in? This, on the other hand, is our preferred facility in Beijing. This is the Beijing United Family Hospital. It's about 10 years old, but as you can see, it's kept up very well. This is our preferred center in Beijing, and it's actually our center of excellence for northern China. And when you go into a hospital like this, first of all, it's spotless, as you can see a little bit from the pictures. Everyone speaks English in this hospital. The receptionists, the nurses, the doctors, everyone speaks English. And, the room is nicely furnished and modern and very clean. And just, it looks like some place where you would go in and feel very comfortable being treated. And so we work with it quite a bit. Now, we divide our centers of excellence into international level and regional level. So the international ones are ones that we evac patients to from anywhere in the world. The regional ones are ones that we just concentrate on evacuating patients from that surrounding area, basically. We use the international ones for almost anything, and we use the regional ones just for that immediate area.